Hi, everyone. Welcome to our town hall event. We'll just wait 15 seconds until folks have joined before we go ahead and get started. We're really excited to have you all here for our presentation today. Okay, we do have a lot to get through, so we'll just jump right into it. So, hi everyone, my name's Kristen Nine. I'm the Capacity Building Director at EverThrive, Illinois. Thank you again so much for joining us today for what is number 4, I think, of our town hall events. Here we go. For those who are less familiar about EverThrive Illinois, we're a nonprofit organization that has been around for 30 years. Our mission is to improve the health of women, children, and families over the lifespan. Oh, I'm just realizing it says my screen sharing is paused. 1 second. Because I am showing slides, but it doesn't seem to be, I'll share it this way. Okay. So I think that's working now. So like I was saying, our missions for over 30 years has been to improve the health of women, children, and families over the lifespan. And we envision a society in which all Illinoisans are able to live their healthiest life. We use a 3-prong approach to accomplish our work: policy and advocacy, community outreach and engagement, and our capacity building activities, which includes coalition building and creating educational resources and events like this one. And we use our values of strong partnerships, diverse voices, and health equity to center and ground our work. Brief housekeeping before we get started. Please keep yourself muted to reduce background noise. We will send out a link afterwards with a recording of this and materials that will be sent out to you all. And then please feel free to type questions in the chat box as we go. There will be a Q&A portion at the end, so we'll hold off on answering that until the end, but we will get to them then. And so our agenda for today is we will be starting with the introductions that we're doing now. We will then have 2 presentations, one from Dr. Stacy Geller on the intersection of housing and the health of pregnant and postpartum people. Then we will have Bob Palmer with Housing Action Illinois present on preventing evictions and securing affordable housing in Illinois. And these are, he'll be providing some updates on the policies that have been in effect during COVID-19 pandemic and how folks moving forward can access supports, housing supports, before the question and answer portion and wrapping up. So really quickly, just to introduce our first speaker, Dr. Stacy Geller. Dr. Stacy Geller is a professor of obstetrics and gynecology and the director of the Center for Research on Women and Gender at University of Illinois, Chicago. She studies the health of women with a particular focus on promoting birth equity and maternal mortality and morbidity. And I will say before turning it over to Dr. Geller, she's having some internet issues, so she's going to be presenting or talking through the slides as I'm sharing them. So just bear with us a little bit if for some reason we end up getting a little off for some reason. So Dr. Geller, I'll go ahead and turn it over to you.
Thank you, Kristen. Let me know if there's any sound issues. 2 apologies. One is the Wi-Fi seems to be down in my area, so I have no control. And secondly, I am definitely suffering from fall allergies. So if I start coughing, I'll mute for a minute, but hopefully we can get through this fairly quickly. So thank you all. A lot of what this talk is about raising awareness about the importance of housing security to improve maternal health. This work comes out of the I Promote Illinois grant, which some of you may be familiar with. It's a HRSA-funded Innovations in Maternal Health grant. I think 11 or 12 were given out across the country, and Illinois was one of them. So I am going to unfortunately have to say next slide, please, every time. Next slide, please.
No problem. Sounds good.
Okay, so this is what I'm going to cover in the presentation, briefly going over social determinants of health and why that's important to this conversation. Um, housing insecurity during pregnancy and postpartum, issues around discrimination and equity, safety in the home, also talking about community safety, environmental a little bit, and some policies and strategies to take us forward. I am definitely not the policy guru here. Hope you have Bob Palmer, who will definitely talk to you about that. But I've been trying to learn more about policy than I thought I ever would as a scientist. Next slide. So social determinants. We're just going to take a little time to explore the relationship between social determinants of health and including housing and maternal mortality, just so we're all on the same page. These are the conditions in the places where people live and work and educate themselves and affect a wide range of health and quality of life risks and outcomes. Next slide. So for us, housing is a social determinant of health because we know, and there are all the resources that we've accumulated, all the evidence at the end of this talk, which won't be sent out at the end right away. I want to be able to edit it after I finish this talk today, but we will share slides. So poor housing, we know, can lead to social, environmental, and a lot of health inequity in particular. We know this is true for marginalized populations, such as single-parent families and women who are more likely to live in unstable housing. I sort of go back and forth with this idea of women and pregnant postpartum persons to try to be as inclusive as I can. And we know that housing, poor housing, unstable housing, unsafe housing can affect maternal and child health outcomes. Next slide. I want to take just a few minutes to sort of ground this in where this all comes from. And it largely comes from the fact that for the last 20 plus years, I've been sitting on 2 maternal mortality committees for the state of Illinois run by IDPH. And that we know, and so that a lot of what we see when we review these cases of maternal death is our social determinants of health, some of which are related to housing and security. So a key indicator of maternal health, and of course always of child health, is the overall health of the community. And for these purposes, we're defining maternal mortality as the death of a woman either while pregnant or within 1 year postpartum. And nationally, we know that pregnant postpartum people, especially people of color, are experiencing adverse outcomes, much higher than the white population. And in Illinois, 754 women died between 2008 to 17. And we know that the impact of structural racism, which of course affects housing security, all plays into this. Next slide. And we know that, excuse me, maternal mortality is basically the tip of the iceberg, and that for every maternal death that occurs and the data changes, there's at least 50 to 100 severe maternal morbidities. Next slide. So I mentioned briefly, there's 2 maternal mortality review committees in Illinois, and many of these slides come from IDPH, so thank you to them. Next slide. And when the maternal mortality review committees meet, we talk about several things after we review the abstract of the case. What was the cause of death? Was it actually related to the pregnancy? Of course, whether it was preventable or not, which means were there any actions that could have been taken on the part of anybody, basically, or the system to have potentially prevented that death? And then what are the critical factors that contributed, and what are the recommendations? Next slide. And this is just the definition of pregnancy-related deaths that I went through. Next slide. This is what the data looks like in Illinois. Some of you will have seen this. Black women were almost 3 times as likely as white women to die from a pregnancy-related cause. Next slide. When you look at the data a bit, what you see are that Black women are more likely to die from a pregnancy-related medical condition than white women. So any kind of pre-existing morbidity, hemorrhage, preeclampsia, hypertensive diseases, etc. While white women were more likely to die from pregnancy-related mental health. That included depression, suicide, and substance use disorder. The interesting thing is when you look overall at the leading cause of maternal mortality in the state of Illinois, it's due to mental health conditions. So that's why it's so important to tease out this data, because if we only focused on mental health conditions, it's possible we could increase the disparity rather than work to decrease it. So it's really important to look at this data. Next slide. And if you look at it by demographics, you see that mortality goes up by age and insurance type, definitely. Next slide. When you look at the social determinants of health and pregnancy-related deaths, and this is a really important slide, you see that at least, and again, this is probably underreported in the medical notes that we review, at least a third of women experienced an indicator of traumatic stress. And that traumatic stressors were pregnant in 63% of pregnancy-related mental health conditions. Over 3/4, slightly over 3/4, experience some kind of financial stress, which again can be directly linked to housing insecurity. So that's why it's so important that when we're examining maternal health, morbidity, and mortality, it's important to look at it not just from a clinical vantage point, but also from the social determinants of health. Next slide. So let's talk about housing insecurity during pregnancy. Next slide. So I'm on slide 15. You with me, Kristen?
Yes, I am.
Okay, great. So we know pregnancy, and it's well documented, can increase a woman's risk of becoming homeless. And pregnant persons face significantly greater health risks if they're in unstable housing or have no housing. The data shows that pregnant women on public assistance have a higher probability of being homeless compared to the non-pregnant women on public assistance. And this is particularly a problem, which we're trying to investigate further, for young women experiencing homelessness, who are then again become at higher risk because they're so vulnerable, lack of reproductive services, access to doctors, of becoming pregnant. So homeless young women are almost 5 times more likely to become pregnant, and far more likely to experience multiple pregnancies, many of which are undesired, than housed young women. Next slide. So a lot of data, and some of it I'm not certainly going to go through every bit of the data, but I'm just trying to give you highlights of this. And this is particularly an issue that was raised for us about housing and security for youth. Among women 18 to 25 who were homeless, almost 50% are pregnant or parents. Parents. 1.1 million children in the U.S., at least at the time that we saw this data, have a youth parent who experienced homelessness in the last year. So I always say to people, if we're not going to focus on the woman at least think about the child. My goal is always to focus on the woman, but they're a package deal in this case. And then you can just see lots of data on homelessness. There was one study we looked at of 142 homelessness service providers throughout the U.S. And there's not a whole lot of programs out there for young parents who are pregnant, postpartum, with young children. So obviously we need the issues that the young people face can and will be different than what we see for older populations. Next slide. So another big issue that we have found is that women who have housing insecurity are very challenged in receiving prenatal care. They have much more fragmentation of their health services, really low accessibility, long waits for prenatal care, or just can't access it at all. And these women often receive inadequate care. The providers either don't know how to care for these women, they have such complex needs, both health and socially. And a lot of the research suggests that women who are homeless face a lot of stigma when they talk about their difficulties. So there's a lot of feelings of shame. There could be transportation issues. And then always a big one, and we see this not just with homelessness, but with women who suffer from depression and substance use disorder, always a fear and distrust of Child Protective Services. Now, I'm not trying to say that CPS is always out to get these women, but they are untrusted by a lot of vulnerable women. Next slide. Also, women who experience housing insecurity had higher rates. We also saw higher rates of substance use disorder, lots of depression, anxiety, PTSD, and lots of other issues. And these women had a higher rate, higher odds of having a preterm baby, which of course meant probably a low birth weight baby. The later in the pregnancy that women had housing insecurity, the greater the link to lower birth weight and premature births. So when you compare household challenges experienced in the 12 months before or actually during pregnancy, homelessness was associated with a greater increase in the ACEs score among children by age 3. So again, link between what happens in pregnancy and postpartum and the well-being of children. Next slide. This is just some more data from a homelessness study summary of women experiencing homelessness compared to not. And that pregnant women experiencing homelessness were more likely to be younger, identify as Black, and live in an urban area. And this was a study done in Boston. Next slide. And this is just the graph from that study. They had a higher rate of behavioral health conditions as well. And you can see that from the blue bar, comparison of homeless women to non-homeless. Next slide. And again, another figure showing that women experiencing homelessness significantly increase the rates not only of maternal morbidity, complications, when compared to women not experiencing homelessness. Next slide. So housing discrimination and equity, which is something I want to talk about for a minute. Next slide. We're on slide 23. So a lot of the literature on housing insecurity, and of course this isn't just for pregnant and postpartum women, but the reason I'm doing this talk today is pregnant and postpartum women are not a group that a lot of people think of related to housing insecurity. So again, it's really important to include this group when we're trying to prioritize needs. Structural racism is very much at the core of housing inequity in America. That's something that probably everyone on this call knows. Things like redlining obviously influences the neighborhood's composition through its segregation and socioeconomic status. And it's clear that where you live affects your health outcomes. 45% of Black and Hispanic households are cost burdened when paying for housing, compared to 27% of white households. And this was another study that found up to 3% of adverse birth and infant outcomes could have been avoided by eliminating severe housing insecurity. Next slide, please. And this is just sort of a graphic showing the influence of housing discrimination on maternal health. And this, it really is to demonstrate sort of the result of historical forces and structural discrimination and its detrimental impact on community level outcomes related to maternal health. And this is especially true in urban communities of color. Next slide. So women giving birth in communities impacted by historically racist housing policies and practices are more likely to experience epigenetic risk factors due to historical trauma, be exposed to stress, be living in households with greater indoor environmental risks and hazards, which I'll talk about shortly, and the infants are also impacted. Next slide. So obviously, COVID has enhanced insecurities. Gender disparities are exacerbated during the pandemic. At least 2.5 million U.S. women have dropped out of the labor force since the start of the pandemic, and it's probably up from there. Either they're leaving their jobs because of child care issues, because of safety issues, or they're losing their jobs at 4 times the rate of men. And so this further results in setbacks for women and children, not only continuing the wage gap, but also to precarious housing situations, obviously. And we see this also, women are often forced to move into unsafe housing situations, either staying with an abusive partner, staying in a shelter where they may not feel safe, living in their car. That's a really big one. And all of this, of course, can increase the risk of COVID infection, leading, as we know now, to much poorer maternal and newborn outcomes. Excuse me. And I'll just take this opportunity to put a plug in. I think we're going to talk about it at the end. But if you work with pregnant and postpartum populations, strongly encourage them to get vaccinated. We know for a fact that pregnant women who get COVID do get sicker, are more likely to end up in the ICU, and their babies more likely to be born prematurely. Next slide. And then this whole issue of evictions, which Bob can talk a lot more, and lifts on the federal moratorium on evictions, we know is just a disaster waiting to happen, not only for pregnant and postpartum persons, but that's the concern of my talk. It's a definite public health crisis, and we know that it will disproportionately affect certain populations. That's just the reality of the day. And these are estimates that show that evictions that took place in the 27 states that lifted eviction moratoriums between March and September of last year have contributed to 433 additional COVID cases and more than 10,000 deaths. And probably these are underestimates. The American Rescue Plan and the federal moratorium on extensions are just certainly steps in the right direction, but additional, much more upstream, holistic approaches and policies are needed, and the prioritization of this vulnerable population of women and young children should be a high priority. Next slide. These are some of the rental assistance in pregnancy studies that we were able to find. There was a study, and it's actually interesting to read. Ohio study measured the impact of providing rental assistance with housing stabilization to pregnant people. And it contributed to a large reduction in Medicaid spending, interestingly. And 70% of infants in the intervention group were born full-term compared to 55%. This study, unfortunately, didn't have any maternal health outcomes, just the baby. But this suggests that if the baby was born preterm, hopefully the woman had a healthier pregnancy. It definitely worked to help improve housing status. For our I Promote task force last week, we had a great talk from Dr. Lizia Malawa, talking about her work in California to literally provide $1,000 to women a month for them to use as they see fit for housing, food, whatever issue they needed to help make their lives safer and more secure. And it'll be fascinating to see what the effect of that study. So the key findings were that ongoing rental assistance provides a critical foundation for families, that many of these families were facing obviously additional challenges from the pandemic. And that when thinking about housing, it's critical to think about racism, violence, and trauma. And without thinking about all those components embedded within housing security, we're not going to solve the underlying issues. Next slide. I want to just talk a little about safety in the home. Violence and housing instability. Next slide is 30. So even for some women, if they have stable housing, violence in the home can certainly adversely affect the health and well-being of pregnant women. Intimate partner violence is anything that's physical, sexual, psychological abuse by a partner. And in one study, results estimated that 3 to 9% of pregnant women and 7% of postpartum women experience IPV. And my guess is that's a huge underestimate, because a lot of women don't report it, of course. Lack of other housing or shelter is a crucial barrier for seeking safety. So there's limited shelters, certainly emergency shelters, and women end up staying, as we talked about, in cars, unsafe motels, sometimes just needing to return to the perpetrator. And immigrant and minority women experience far more barriers. And again, COVID has added to this as well. Next slide. Experiencing IPV during the prenatal period obviously negatively affects pregnant women's perception of parenting and confidence and ability to bond with the child. These infants born to women who experience IPV during pregnancy are more likely to have low birth weight, require intensive care treatments, and obviously do not do as well. And IPV, even if it's stopped during pregnancy, often resumes after pregnancy. And so the postpartum period can be really critical. Next slide. Community safety and housing. So just a little bit on raising awareness on this. Women who live in violent and physically decayed neighborhoods are more likely to experience pregnancy complications and adverse outcomes. And we saw this a lot with our reviews of women living, having to live in unsafe communities, and being the target of even violence that was not intended for them. And that we see that these communities are definitely associated with a lot of clinical complications, hypertension, preeclampsia, low birth weight, and preterm birth. And there was a study in Pittsburgh that showed that neighborhood environments expanded some of the increased risk for preeclampsia among African American women. Next slide. In Chicago, we know that higher total neighborhood crime rate was associated with higher rates of preeclampsia, hypertension, preterm birth, and small for gestational age. Next slide. So the environment, how does that affect housing and safety? Environmental exposures are related to adverse birth outcomes, which we know. This is tobacco, smoke, lead, carbon monoxide, air pollution, heavy metals, pesticides, and on and on. And these are all associated with risks of preterm, low birth weight, intrauterine growth retardation. We know that elevated lead levels in pregnancy in unsafe housing environments have been associated with hypertension, spontaneous abortion, low birth weight, and impaired neurodevelopment. And certain communities of color and impoverished communities are obviously exposed much more to these environmental hazards than other communities. Next slide. We know about the exposure to mold and dampness increases the likelihood in low birth weight. Overcrowding housing was associated with infants being born in the 10th percentile or lower for gestational age, and mothers experiencing housing disarray. So whatever that means, any kind of instability, more likely to move, or more likely to screen positive for depression and generalized anxiety disorder, which of course all of this affects access to prenatal care, ability to get to prenatal care, ability to engage in having a healthy pregnancy. Next slide. So a few minutes on policies and strategies, which I'm sure Bob can update us on. In the U.S., Medicaid expansion under the ACA was associated with better health coverage for reproductive age women, decrease of about 7.5% in the probability of being uninsured. It improved adequacy of prenatal care, and there were some fewer maternal deaths per 100,000 women, whether it was directly related to ACA or combination of things. I'm a big believer that no one thing will ever reduce maternal mortality and morbidity. It has to be a real combination of things, a real paradigm shift, really thinking about maternal mortality and morbidity aside from just the delivery and what happens clinically. As many of you probably know, Illinois approved the expansion of Medicaid in the postpartum period in April of this year. We were the first state to provide continuity of full Medicaid benefits throughout the first year of life for the baby and for the woman in the first year postpartum. A lot of the push for this came out of seeing how women fall off at 6 to 8 weeks of Medicaid and weren't able to receive the services they needed in the first year postpartum, definitely leading to greater vulnerability, affecting housing, transportation, things like that. So we think this is a really important step forward. It needs to be studied. Hopefully someone's going to study it. And how it really does affect access to care for pregnant and postpartum women, who, especially those experiencing housing insecurity. Next slide. So these are some policy suggestions that we have that we're hoping a lot of people involved in policy will look at. That we're, since so many women have trouble accessing prenatal care, if they're homeless, that we advocate for shelter-based interventions that actually provide prenatal care right on site. Don't make women get on a bus with their other kids. Just you come to them. And there obviously needs to be more programs which provide units conducive for families, right? And obviously policies that support fair and just housing. It's easy to say eliminating racist restrictive covenants in housing, but we really have to sort of help people who are developing these policies and programs really rethink how they're doing it. There needs to obviously be more funding for federal housing programs, and really trying to think about the services that need to be delivered in a way that recognizes and meets homeless people's complex, very complex needs. And then obviously COVID has amplified all of this, so we need to continue building on and supporting any legislation passed during the pandemic, so it all doesn't just go away as we begin to move beyond COVID, if we think that's ever going to happen at this point. Next slide. And these are just some policy examples, which I'm not going to spend any time going through, but they're here. Next slide. And again, this takes me back to something I talked about in the beginning. No one intervention is going to make the huge difference we want. Housing is critical, but it can't be addressed in isolation. We also have to work on community safety, economic stability, and really trying to have policies that promote and enforce screening in healthcare systems. So how do we best take care of the women who have housing insecurity, who may have substance use disorder, may be depressed, may be experiencing a lot of trauma. And we also talk about, and one of the issues that we try to deal with in I Promote is paid family leave. But it always makes me think of the women who aren't working and have a baby, and what kind of support do they get to be able to stay home with the child. Next slide. And this is sort of a little bit about I Promote, which I told you about. We're one of 9 states that got this grant. Next slide. For those of you who aren't familiar with I Promote, just a brief overview. We have a maternal health task force from across the state that tries to think about and create and implement a strategic plan that incorporates a lot of the activities outlined by Title V. We work with various groups across the state, including EverThrive, of course, and that this actual presentation today comes out the root causes of health inequities, a group that I'm part of from the task force. We also work on improving data and improving care. Next slide. And the root causes committee, which I told you about, is these are just some of the things that we've been doing. We're working with IMMT, or the Maternal Mortality Committee, on IMMT never follows the correct name of the committee, so it's about reducing disparities on maternal and infant health outcomes. We're working with them on trying to do some implicit bias training, as well as a number of other things. Next slide. And these are just some of the activities we have planned. So we're going to be doing, we're convening partners to create an inventory of available housing resources. Right now, we're holding virtual presentations like this. We're working with IHDA and their Illinois Housing Blueprint to ensure the housing needs of pregnant and postpartum persons and families. We're supporting as we can the governor's new interagency council on fighting homelessness. Next slide. So basically, if nothing else, for those of you who are thinking about housing, when you think about safe and secure housing, we want you to think about pregnant and postpartum persons. We know that access to housing or the lack thereof is a social determinant of health, and we so much know that where you live can make you sick or make you healthy. And as much as we all believe that care is a human right, we believe housing is a human right, safe housing as well. Next slide. I just want to do make you aware of this. We are working with the Illinois Housing Development Authority doing listening tours. So I've just presented a lot of evidence, data, studies that tell you this is a problem. Hopefully you believe it. But we are doing these listening tours. One will be in November, one will be in January. And we're looking for pregnant and postpartum people and families with young children with the actual lived experience of homelessness or housing insecurity to share their stories during these sessions. If you know of anyone, this is Nikki Brown is our research assistant. You can get in touch with her, you can get in touch with me, you can get in touch with Kristen. We will compensate women for their time. It'll be a 2-hour listening session. IHDA will use this to help inform their blueprint. So again, another way to raise awareness about the importance of housing and security for this population of people. And I think that might be the end of the slides.
Yes, thank you so much, Dr. Geller. And I just shared the flyer for the listening sessions in the chat with everyone. So if you know anyone that's interested, you can pass along the flyer there. Thank you again, Dr. Geller. The only remaining slides were references, and once Dr. Geller's updated the PowerPoint, we'll make sure to share that out with folks. So Dr. Geller, if you don't mind sticking around for the end, we're going to switch gears and have Bob Palmer present now. And then once he's done, we'll wrap up with about a few minutes at the end just for questions with folks. So thank you, Bob, for joining us today. Bob Palmer is the Policy Director at Housing Action Illinois, and they are a statewide coalition formed to protect and expand the availability of quality, affordable housing throughout Illinois. So take it away, Bob.
Thanks, and you can see my slides?
Yep.
Okay, very good. So I'll be very brief because I know there's not much time left. I want to have some time left for questions, and I'm sure the slides will be shared afterwards. So here's my contact info on the slides if people want to follow up. Housing Action Illinois, we do appreciate Ever Thrive Illinois inviting us today, because working with groups outside the affordable housing sector is something that's increasingly important to us. And we are part actually of a national campaign called Opportunity Starts at Home to get groups outside the affordable housing sector advocating at the federal level for affordable housing. So I'm just sharing the website there, which is opportunityhome.org, and Housing Action Illinois is sort of leading the effort in Illinois. One of the other groups we're working with, and maybe there's some people from there on the webinar today, are from the Illinois chapter of the American Academy of Pediatrics, as well as others. So the status of the eviction moratorium, lots of bullet points here. the one important thing to know is that the Illinois eviction moratorium is still in place. It's actually going to be in place through October 3rd. Governor Pritzker just released the final executive order extending it for a bit longer. Since August, basically, landlords have been able to file eviction cases in court, but there's still a restriction on law enforcement carrying out evictions against, importantly, covered persons, people who've given a form to their landlord basically saying they're unable to pay rent because their income is inadequate and they're trying to pay rent and they have to attest to certain other things. Even though the eviction moratorium is almost over, I think it's still important for people, if they haven't provided that form to their landlord already, they should, because it'll probably protect them later on in the process. And down in the last bullet point here, there's a link to where people can go on a website to get a copy of that form. And it's available in multiple languages. So it's a bit confusing because there's multiple rent assistance programs that have been available through the city of Chicago, Cook County, various other counties. There's multiple state programs, but the main website to go to right now for an open program is IllinoisRentalAssistance.org. And once you're there, if you go to the provider network tab, it has lists of agencies that the Illinois Department of Human Services has contracted with, where people can contact them and apply for rent assistance. There's other lists of resources here, such as cookcountylegalaid.org or eviction help illinois.org or rentervention.com, where people can get legal assistance. At that rentervention.com, you can get help filling out one of the declaration forms. And the last bullet point on our on this slide is on our website. We on that page, housingactionil.org/ERA. There's more information about the rent assistance programs that are available. Oops, sorry. So also in mid-September, on September 15th, actually, there was a court-based rent assistance program that was launched in 101 of Illinois' 102 counties. The Cook County program will be launching later in September, or perhaps the beginning of October. And basically, this is one more way, particularly for people who have not submitted a rent assistance application yet, or maybe that they have one that's pending, or they got rejected for whatever reason, they didn't have adequate documentation. They can apply for rent assistance directly through the court system through an online web portal. This is only open to people who have a eviction case, and so you have to provide your court case number. There are no citizenship or immigration status requirements, just like the other programs that are available with this particular pot of federal money, and there's dedicated staff to hopefully expedite these court-based rent assistance applications soon. Again, the Cook County program will be available at the beginning of October, and I think probably the best website to get updates on that is through this cookcountylegalaid.org. As soon as that's available, I'm sure it'll be posted there, or on our website too at Housing Action Illinois. So there's more housing resources there. Won't go over those. We'll wrap up by talking about the resources that we need, that we heard about in the previous presentation, and we thanks for the support on that. So in the recently completed General Assembly session that ended at the end of May, there were several good pieces of legislation that we and others advocated for, creating new resources for the short term, and also, but even more importantly, for the long term. And then also Illinois invested some of the federal fiscal recovery funds, about $114 million, to use for the creation of affordable rental housing primarily. So we have a wrap up. It's the last link on this particular slide, goes into details about that. People can read that. And then we do have, wrapping up, just a quick advocacy ask. People probably know that Congress and the Biden administration are currently negotiating a couple different infrastructure bills. There's one that's a bipartisan bill that focuses more on traditional infrastructure like roads and bridges and transit, that sort of thing. But there's this, what at this point is a partisan, supported only by Democrats, infrastructure bill that includes lots of other key priorities. And there's lots of resources for affordable housing in there, including more money for housing choice vouchers to hopefully significantly reduce a lot of the waiting lists that are out there for housing choice vouchers. And this is part of a long-term goal to make housing choice vouchers an entitlement, so they would be available to everyone who's eligible. There's money to fix up public housing. There's money for the National Housing Trust Fund to create rental housing for extremely low people with extremely low incomes. There's also down payment assistance, particularly focused on closing the racial wealth gap, and lots of other good things. But the last bullet point here, we have an action alert on our website that would be great if people would respond to. And basically, if you go to that link, within just a couple minutes or longer, if you want to edit our sample letter, you can send a letter to Senator Durbin and Senator Duckworth and your member of the House, encouraging them to support these priorities. So I think that's the last slide. And again, my contact info is on the first slide. So I went over a lot of information really quickly, but people can contact me afterwards if they have more questions.
Thanks so much, Bob. I'm really excited to share all the resources that you compiled and put together for everyone, because I think that's the thing that'll be most helpful for folks. So thank you so much for putting that together and sharing with everyone. And like I mentioned earlier, we'll send the resources out to everyone afterwards. So now we've entered our Q&A portion. So I'm going to turn it over to my coworker, Kirby Range, who's our birth equity manager here at EverThrive Illinois. And she's going to spend the next 5-ish minutes getting through as many questions as we can. And then I have like 1 or 2 minutes of wrap up slides at the end. So Kirby, I'll turn it over to you.
Yeah, thank you, Kristen. Hi, everyone. So I know there are about 4 or 5 questions in here. So I know we may not be able to address all of them, but we'll be sure to provide contact information. You'll get that in the recording in the event you would like to ask specific questions for Dr. Geller and for Bob Palmer. So let me go back up and let's go through one of the first questions that was posed. Okay, and this question comes from Jess. She would like to know, Dr. Geller, how have maternal mortality deaths by race changed in the past 1.5 years of the pandemic? And then her second part of her question was, because there are many landlords that have abused the eviction moratorium in Illinois, do you expect maternal mortality to increase in the next year?
Thanks for those important questions. I unfortunately don't have the most recent data. We don't understand the full impact of COVID on maternal mortality and morbidity. But I'll tell you my hypothesis, it certainly hasn't helped reduce racial disparities, and I'll be shocked if it hasn't increased them. We're always slow to get, I shouldn't say slow, it's the reporting process to IDPH. It takes them a while to collect all the data, be able to examine all the cases. So we're always a few years behind in the most accurate data. I know IDPH is collecting maternal mortality cases specifically related to COVID now, and there'll probably be some special review of those cases, partly because COVID is such a complex disease that we won't be able to have the usual partners examining those cases. We'll need a lot of specialties that aren't normally involved. So it's a great question, and stay tuned for the answer. I unfortunately don't have it.
Got it. Thank you, Dr. Geller. Also, are there any specific repercussions that mothers living in those poor conditions that you mentioned, such as mold or dampness or lead exposure, that they can possibly sue around if they're living in those types of conditions? Are there ways that landlords and housing institutions can be held accountable for to be informed that lawsuits are possible if they do not properly upkeep their properties and have their tenants living in these conditions?
Well, Bob may know the answer better than I can imagine there are some kind of policies and procedures and regulations. The problem is a lot of these women don't have either the expertise, the wherewithal, the financial ability to address them. And so unfortunately, landlords get away with this. And there's a lot of action it often isn't taken. I don't know, Bob, do you have anything to add?
Well, particularly on landlord-tenant relations, one thing that people might not know that could be helpful to some people on the call is that suburban Cook County did pass a landlord-tenant ordinance early this year that went into effect in June. And so we are working, it's been a long-term goal of ours to get more protections for tenants so that they're not just living in affordable housing, but they're also living in safe and decent housing. And so that's a new state law that's kind of moving us, or new local ordinance that's moving us in that direction. So there aren't specific provisions in there, like for example, around mold, but there are around housing conditions. So I'll put a link for people to find out about that in the chat.
That's great. Thanks.
Thank you both for answering those questions. Kristen, I don't know if you would like to use the last couple of minutes for your closing, or if you'd like for us to go through some more questions.
Yeah, it looks like there might be one more, so maybe we can do that last one before wrapping up.
Yeah, sure. So there is another question we have around, are there any specific birth homes or shelters for expecting women and postpartum persons or families, so such as group home types for housing care facilities that are also staffed with healthcare professionals such as nurses, OBGYNs, pediatricians, where payment is covered by the same federal funds that support other programs?
That sounds perfect. Can we develop it? To my knowledge, there's nothing in Illinois, unless someone knows something else. But it sounds ideal.
Yes, it does. Thank you.
Wonderful. Well, thank you again both so much for your presentations, answering questions, sharing all the resources that you have with us. A couple of things we'll share just as we're wrapping up. Folks know we've been promoting this on all of our previous town hall events too. We relaunched our Healthy Choices, Healthy Futures Perinatal Education Toolkit this past year, which includes resources and links to services and programs for pre and interconception, prenatal and postpartum folks. And so it covers a wide range of topics for folks in a variety of stages in the reproductive lifespan or reproductive journey. We, as mentioned, will send out presentation materials to those that have registered and attended today. My colleague Andy did share a brief survey in the chat, and the link is up here as well if folks have 2 minutes to provide us some feedback so that we can keep improving these events as we move forward. And then the last slide, just to wrap up, and Dr. Geller mentioned this earlier, we will be continuing our town hall events, and the next one will tentatively take place on Monday, December 6th at the same time, since this time seems to work for folks. And we're really going to be focusing on COVID-19 vaccinations in the next upcoming town hall. We did, I think it was two or three town halls ago, we also focus on COVID-19 vaccinations, but a lot of things have happened since that, and so we want to provide an update. And like Dr. Geller mentioned, they have come out with some additional, the Centers for Disease Control and Prevention has come out with some updated guidance on COVID-19 vaccinations for pregnant and postpartum people after some additional data has come to light. We know that pregnant people and recently pregnant people are at increased risk for severe illness when compared to non-pregnant people, and also at risk for preterm birth, etc. And they have come out to show, or they have found that the overall risk for vaccinations for pregnant people does not differ from folks who are not pregnant or postpartum. So it is recommended right now that all pregnant people, breastfeeding people, and people who are trying to become pregnant now or in the future get a COVID-19 vaccination. So during this upcoming town hall, we'll talk a little bit more about that and share recommendations with you all. The last slide here is just my contact information. Thank you all so much for joining us today, and we hope that we'll see you at the next town hall in December. Have a good one, everyone.